आपका नाम क्या है?
हाँ जी, मेरा नाम है सीमा।
हाँ जी, क्या दिक्कत है आपको?
हाँ, मेरे को 15 सालों से अस्थमा था,
हाँ जी।
लेकिन अभी मेरे को बहुत आराम है।
अभी 15 साल से कितना बार लेते थे आप पफ
सर्दियों
वो?
में तो हर घंटे,
हाँ हाँ।
जैसे ज़्यादा हो जाता था तो अभी ले लिया, फिर थोड़ी देर में फिर ले लिया।
अच्छा।
ऐसे ही अस्थमा
अंदा
का अटैक आ जाता था।
अच्छा, अंदाजे में कितना कितना बार लेते थे पंप आप?
नेचुरल में 3 बार।
3 बार लेते थे
3।
आप पंप? अच्छा। यहाँ से कितना महीने हो गए अभी आपका दवाई शुरू हो के?
जून में चालू हुआ था।
अभी आपको कितना % आराम लग रहा है 100 में से, मतलब अंदाज़ा से?
70% लग रहा है।
हाँ जी। जब शुरू में आए थे मतलब इतना खांसी था, अभी खांसी कैसा है?
खांसी में बिल्कुल आराम है।
अच्छा।
सांस में भी आराम है, माइग्रेन में भी आराम है।
हाँ जी, गरगरा होते थे
वो बिल्कुल ठीक हो
सांस में?
गया। हाँ।
अभी छाती दुखना, गरगरा साउंड आना और सांस लेने का दिक्कत सब ठीक हो गया ना अभी?
वो बिल्कुल ठीक हो गया।
जी। बीमारी को लेके आपको क्या लगता है अभी?
जी, मेरे को तो लग रहा है कि अस्थमा तो मेरा अब जड़ से ही खत्म हो जाएगा और मेरे पफ की कोई जरूरत नहीं लगेगी।
हाँ जी, ठीक है। So this was the case of bronchial asthma, a patient of 40-year-old female with a 15-year history of bronchial asthma. So bronchial asthma per se is an obstructive lung disease of FEV1 by FEC ratio was of course less than 70% in this patient. So since 15 years she has been very much tormented and distorted, distressed by the treatment of conventional medicine. So every summer and winter, even in the summer she used to take at least 3 times of the bronchodilator, 3 times in a day. So in the winter it is of course, as she only herself told, that every hourly she used to take a bronchodilator, so which was very much distressing for her. Since 6 months we are treating this patient, and this patient has been given the constitutional medicine in the initial days. So in the, of course, the constitutional medicine is doing their action in the background presently also. So on examination of this patient, there is a lot of mucus which has been accumulated. So along with the mucus, there is expiratory wheeze which is found. Of course, it's very obvious of asthma. We have been considered the constitutional treatment in the initial days, so during the summers. So during the summers, of course, during the summer itself, she is dyspneic. She is taking at least 3 times the bronchodilator, 3 times in a day. So during the winters it's very worse for her. So she only mentioned like every hour she used to take a bronchodilator in the winters. So by the end of September, at the end of and the beginning, beginning of the winters, this she was telling she's experiencing a lot of dyspnea, and the bronchodilator usage was increased from a 3 to 7. So 3 times to the 7 to 8 times per day. So after that we have considered the basic modality, and we have prescribed based on that. So based on that we have prescribed conium 200 for 3 days. Rubric asthma morning waking on. So after that she's doing better with the conium. So since the beginning of November she doesn't used any kind of bronchodilators up to the end of the November. At the beginning of the December, as the foggy day begins, her complaints used to aggravate again, so coming back again, so which is a less intensity. Of course we are prescribed due to the conium, the intensity was decreased. Dyspnea intensity was decreased. So initially it was like grade 3, grade 4 dyspnea. So after constitutional medicine it has reduced up to grade 2 dyspnea. At the winters it's very worse for her, like it is definitely going for grade 4 every winter. But after conium it has reduced to grade 3 around, and grade 3, grade 2 around. So she is not using any bronchodilator. But after that, in the beginning of the December, so due to foggy weather, it is getting aggravated in the early morning. She only said this modality. So based on modality, we have prescribed, of course, hypericum. So along with hypericum, we have natrum sulf. You can look at this rubric. We have 2 medicine: foggy weather aggravation, hypericum and natrum sulf. If hypericum fails, you can prescribe natrum sulf. So along with, if the patient is staying in a damp cellars and the damp aggravation, so you can consider natrum sulf in that condition. So since 6 months her treatment is going on, I'm not claiming it's a cured case of asthma, because you can say it's a better way of management of asthma. So since 3 months she is not using any kind of bronchodilator, not even a one single episode she used a bronchodilator. So she is only on homeopathy. So think like every hour she is using a bronchodilator. To the she has not used the bronchodilator since 3 months. So you can see the distress, level of distress, and the amount of money she has saved. Not the amount of money, of course amount of money matters for the middle class people, but the thing is the suffering which it has reduced, homeopathy has reduced, and the quality of treatment you have seen in the NH is of course great. So this was about the case of bronchial asthma. Thank you.